Coming to dysbarism, dysbarism is also known as Casson's disease or decompression sickness or diverse palsy or bends. A person after staying for some time at higher barometric pressure, if suddenly exposed to the low barometric pressure, he suffers from a group of symptoms called dysbarism. When the individual ascends rapidly to sea level after sufficient exposure to high atmospheric pressure deep in the sea, the nitrogen is decompressed and escapes from the tissues at a faster rate. Being gas, it forms the bubbles while escaping rapidly from the tissues. The gases block the blood vessels, producing tissue ischemia and sometimes tissue death. Caisson is an air chamber used to lower individuals uh, to work deep under the sea. They suffered from dysbarism and thus it is also called as Caisson's disease. This problem was also faced by professional drivers and tunnel workers who were exposed to high barometric pressures. Some of the symptoms of dysbarism are pain in the joints and muscles or leg or arms. The joint pain accounts for the term bends and is often applied to this condition. The chokes. The chokes refer to the serious shortness of breath, which is often followed by severe pulmonary edema and occasionally death. Neurological symptoms like dizziness, paralysis of muscles or collapse, paresthesia, and unconsciousness may occur due to the blockage of blood vessels of brain and spinal cord. There can be paralysis of the muscles and may occur temporarily due to the presence of nitrogen bubbles in the myelin sheath or motor nerve. And this is called as diverse palsy. Coronary ischemia or myocardial infarction may occur due to the blockage of coronary capillaries by nitrogen bubbles. When a person stays at higher barometric pressure, his blood is equilibrated with to the air of that pressure. So all the gases dissolved in the blood increase proportionately, including nitrogen. Now, when the person is suddenly exposed to low barometric pressure, these gases are liberated from the blood. Carbon dioxide poses no problem as it can diffuse quickly and oxygen can be utilized by the tissues. But nitrogen bubbles cannot be got rid of easily because they obstruct the blood vessels and produce symptoms stated above. How to prevent dysbarism? Diver or caisson workers should come to the surface slowly. The treatment involved is the tank decompression. It is the most important method in treating people with whom the symptoms of decompression develops. In this case, the diver is recompressed immediately to a deep level. Then decompression is carried out over slowly